Hi, this is Christine Reichert. I am at Indiana State University and a student in the Doctorate of Athletic Training program. Today I'm going to be meeting with one of my patients who just recently was diagnosed with having a posterior lumbar disc herniation. He will be receiving surgery in about 4 weeks. Until then, we are here to discuss a treatment plan for him for home and to help control the pain and kind of get him an idea of what his injury is and how he's going to handle it in everyday life. Hi, Chris. So I think you've noticed now that your MRI results did come in, and hopefully the doctor kind of explained to you that you do have a posteriorly herniated lumbar disc. That sounds like a lot. So I'm going to break it down for you and kind of let you know what's going on. So your spine, where the issue is a collection of bones that all lay on top of each other. In between these bones, you have this disc that helps with the mobility of the spine. So when you bend over, when you go side to side, that's kind of what helps to do that movement. Now what's happened is when you injured yourself last Friday, you went to bend forward, right? You were meant to pick up the weight. Okay, so when you bent over, whether it was because it was too much weight or if you had bad form or maybe it was just a collection of stress on your body and it just couldn't take anymore, what happened is the disc in between those two bones bulged outward. So when you bent over, if you imagine my two fists being the bone and in between is the disc, when you bent over forward, the disc had no place else to go. It couldn't go forward because it had the bones there, so it protruded back, out towards your back. Now the reason you're having that pain down your right leg is because now that disc is where it doesn't need to be. Now it's bulging into nerves that run all up and down your back. So what's happening now is on that one side, you've got that nerve that's very irritated with that disc. So in about 4 weeks, when you are going to get surgery, that's going to help correct that issue so that you won't have that pain going down your right leg. Now today, we're going to be talking a little bit about how to manage this condition. So we're going to talk about how this impacts your home life, your work life, and your recreational sport life, because you are a football player in a recreational league, right?
Yes.
Okay. So, and then we're going to talk a little bit about how to maintain how to control the pain, and then hopefully get some exercises in here that's going to help limit as much of that pain as possible, hopefully getting you on the right track. What we really don't want to do is limit you too much for your daily activities. So today we're just going to have a nice discussion about how we can go on from here.
Okay.
Sound good?
Thank you.
Perfect, yeah. All right, Chris, so I know that you work full-time at a computer, so one of the things we definitely want to address is how you're sitting at a chair. Because sitting does exacerbate the injury, we want to make sure that when you do sit, you have excellent form. All right, so now what I like what you're doing right now is that this chair is at the appropriate level. So I like that, see your hips are at 90-90 here, so that way you are firm and that you're steady here, and it's a good way to have decrease the pressure on your back. Now this chair does have a curve in it. When you sit down, what I want you to do is make sure that your spine aligns with that curve. We want to keep that what we call a lordotic curve. It's that natural curve in your spine. We want to keep that so it's in line there. Try not to hunch over too much. When you sit, do you have armrests at your office?
Yes.
So when you do have armrests, what I want you to do is I don't want you to put your hands on the armrest. I want you to just put your forearms. When you do work, I want you to scoot a little closer to the computer. Perfect. I never want your knees to be touching the back of this chair. All right, we want to make sure there's 2 or 3 inches between those two.
Okay.
Now, when you're focused here on your computer, I want you to examine your workplace. If your computer, you find that it's too high and you feel like your neck is up, I want you to just lower it a little bit. And you don't want to make sure you're here either, okay? So I know laptops are low. If you can elevate it with some books or maybe a box, make sure I want you to keep your face as straight as possible. Okay? And then when you sit for long periods of time, we want to make sure that it's no longer than 30 minutes. So I know office work is time goes by really, really slowly and you're there for hours. But set a timer on your watch or leave a note on your desk and make sure that about every 30 minutes you get up and take a lap around the office. We don't want you sitting for long periods of time because that can really exacerbate the injury. All right?
Okay.
Cool. Now the only other thing we want to discuss today is how to get up out of bed because it can exacerbate the injury also. So come on over here with me. Now when you go to bed, I'm assuming you are a back sleeper. I think you told me that, right?
Yes.
Good. So when you're here, it's very important that you don't just hop up, okay? That's a lot of flexion here, and that's what's caused your injury. So instead, I'm going to move this way just so you can make sure and see what I'm doing. So I want you to lie here, okay? I want you just to bring your knees to your chest first, and then just roll over all at once, all right? So you're going to have your knees here. Now what I want you to do is just do it a little bit to the edge of the table, okay? The goal here is to swing your legs down and lift your torso all at once so that you can keep that straight back, all right? So like I'm doing right here, all of a sudden, like swing down, torso goes up, and then I'm up. Okay? Why don't you go ahead and try that for me, and that way I know that you're doing it right when you go home, okay? So go ahead and start on your back. Perfect. I'm going to be on this side of you. All right, so what you do is go ahead all at once. I want you to roll over onto your side. Oh, knees to chest, of course, yes. Good. Good catch. So knees to chest, perfect. Go ahead and roll to your left. Perfect. Just like that. Good. See how this is nice and aligned here? Now, what I want you to do again is swing your legs down and use this arm to push yourself up from this side all at once. Good. Excellent. Just like that. Now, it will take a little bit of practice, but that's really going to help decrease the pressure on your back when you get up out of bed. All right, Chris. Another way that we can help manage the pain is that we're going to do a little bit of core strengthening. It's going to help decrease that pressure off your back, and it's going to help stabilize what we notice as your core, which goes all the way around, okay? So the first exercise we're going to do is good. I want your knees bent. Perfect, just like this. We're going to focus on contracting these muscles here called your transverse abdominis that control and provide stability to that core, okay? So what you do is have your hands at your sides. Okay, now what I want you to do, it's an interesting way to describe it, but it's almost as if you're trying to pull your belly button to your spine. It's almost like you're sucking in, but what I want you to make sure not to do is use these center muscles. I want you to focus here on the sides a little bit, because that's what the muscle we're trying to reach. Another way that some people like to describe it is almost as if it's stopping a urine mid-flow, okay? So almost like you have to go, but you're going to stop that. So that it's contracting these muscles here, okay? So what I want you to do is I'm going to put my hands on you. Is that okay? Perfect. I just want to feel those muscles contract. So go ahead and try to pull your belly button to your spine. Good. See, I feel those contractions here. Now what I want you to do is if you're trying flexing your core, I don't want you to flex in the middle, okay? What we're going to do is we're going to have repetitions of this. This might seem really easy at first, or even if it's not easy, it's really going to help. You may not feel the benefits of it, but soon when you start to do it more and more, you will. So again, I'm going to put my hands on you right here, and I want you to go ahead and contract. Good. I want you to hold it for 5 seconds, and then relax. Good, good. Don't hold your breath. We want you to breathe normally through this, okay? Good. Go ahead and contract again. And relax. Good, good. So I'm going to make sure and put those sets and reps on your home exercise program, but that's really going to help to strengthen that core, okay? The other exercise we're going to do is going to be lying completely on your stomach. Now, it's that flexion that hurts you, so we don't want to put you in any flexion and as little as possible. So laying on your stomach is really getting a little bit of extension of your back, and that's really going to help with the symptoms. So go ahead and roll over and get on your stomach. I know that's a little painful for you, but how does this feel lying on your stomach?
Not too bad.
Not too bad? Okay, you do feel a little bit maybe?
Yes.
Okay. What we want to do is hold this for about, lay what we call prone, just on your stomach, like 30 seconds, like 3 times 30 seconds at a time, all right? Now, at home, I'm going to give you a couple of ways to progress this. If this gets too easy, the next thing I want you to do is to bring your elbows up and just lean on those elbows. Good. You see a little bit more extension here. That might be a little painful for you right now, so let's go ahead and go back down. So the next step would be your elbows, and then after that, you want to bring up and almost like we don't want to do that right now. It's a little too much for you right now.
Okay.
But would be almost like you're, lifting your chest up and curving your back, but on your arms, okay? But you're going to leave your hips on the table.
Okay.
So that's the next progression. But I will include pictures in your home exercise program so that you know, and of course, you can always come in if you have any questions.
Okay.
Perfect. So those are the 2 things I want you to really work on today, strengthening that core and this maintaining the mobility with the extension.
Okay.
Perfect. So we did talk about the extension exercises and the core that I want you to do at home. Another way you can help manage the pain is with some ibuprofen, some Motrin. We want to get what we call NSAIDs in your system, so non-steroidal anti-inflammatory drug. So right now, that disc herniation is causing a lot of pain and inflammation. Your body's confused on what's happening, so it's overreacting. So we want to be able to maintain that, make it a little bit more comfortable. So ibuprofen, Advil is a good thing to do. Motrin also has that ibuprofen if you prefer Motrin. The other one you can do is Aleve, which is also called naproxen. So if you want to get that generic name of it, that's what it's called. But this is all going to be written down for you. I just want to make sure that we discuss it in person. Okay. And I do want you to follow the labels on the drugs themselves. I don't want you to think you have to take more than you need to. From there, what I want you to do primarily for the first week or two is use ice. Okay, I don't want any heat. Okay, no hot tubs. That might make it feel really, really good at first, but all that's going to do is bring all that inflammation back in, and it's just going to make it worse. Okay, so let's stay with cold. Okay, so cold packs, bag of ice, anything like that is perfect. So what I want you to do is lay that on the injured area, only about 20 minutes, and then make sure that you can ice as much as you want to. In fact, I encourage it, but just make sure that between sessions you have about an hour. Okay, we don't want to cause too much craziness in there. Yep, and so now in a week or two, if you feel that now you're feeling stiff, you don't feel like you're a lot of sharp pain going on, you don't notice that it's red or swollen anymore, and you feel stiff, then we can talk about going into heat, because then the heat will kind of help loosen the muscles that are probably spasming because of the injury, kind of relaxing that, because that way, without the inflammation, it's not going to make it worse. Okay, but I want to make sure that for the first week and a half now, we stay with ice. Okay, perfect. Now, at any point during any of the home exercise program, now you will be coming in, so I will be seeing you, but if at home you notice that you're having more tingling or numbness or even a lot of pain in your right leg, or even on the injured area, you need to let me know, okay? Call your doctor, one or the other. And the other thing we want to look out for is if you lose control of any bowel or bladder habits, because that can be a sign of a more serious injury that warrants emergency attention. Okay, so just monitor those for me. I don't expect them, but if it does happen, don't worry. Call the doctor or call me, and we'll get you the treatment that you need. Okay. Perfect. The last thing I want to talk to you today is about your activities of daily living. All right, I know that you are a recreational football player. I know that you have a family, and you do have the work. Now, we did address the work, which is excellent. The only thing I wanted to recommend is that you talk with your manager on Monday. See if you can invest in a standing desk. That's really going to help you. Now, most companies can supply that. However, if it's not possible, that's why we did do the sitting tutorial here, is that I wanted to make sure to limit as much pain as possible during the work day. Now, I know that you have the adorable little 1-year-old of yours. I know she's light, but I would really need you to not pick her up. Even though it doesn't seem like a lot of weight, any movement here of picking her up and placing her on their hip, there's a lot of twisting and flexing, and that's really what we want to avoid, okay? I know your wife is at home, so if she can help you out with that even more, I know that would really aid in your recovery here. And then, try and avoid lifting heavy things. I know your daughter's not that heavy, but if you're trying to lift boxes or helping somebody move, try and stay away from that. I know those are limitations that aren't ideal, but they are going to help you in the long run. Now, the only other thing is your recreation. Now, I know that you love football, and I fully encourage you to take part in all of your practices and games and social get-togethers. You will not be able to play until after surgery. That needs to be cleared by a doctor. Right now, it would just make the symptoms so much worse, and we do not want you getting any worse, which just means a longer recovery for you and a more serious surgery. So, but go to practices, go to games. I fully encourage that, to take part in that. After surgery, if all goes well, which I don't expect it not to, we can talk more about long-term limitations, but you might have to make some daily adjustments just with your workplace, maybe the standing desk, something to invest in full-time, or even if you become a manager for your football team instead of a player, I mean, that's something that we can discuss then. But right now, the limitations I'm seeing are just really, picking your daughter up, lifting heavy boxes, limiting that physical activity, and just maintaining that pain and control. So I see success with this. I'm not worried. I think that you seem very committed to doing this. So we can always, of course, if you have any questions or comments or concerns, feel free to contact me or your doctor, because we do work hand in hand. But I do see this being a success if you stick with it, and I'll be seeing you in the athletic training room between then. But I think it'll be great, and hopefully you'll see a reduction in your pain, and then the surgery will just make you a brand new man.
Okay, sounds good.
Awesome. Thank you so much. I'm glad we've had a chance to discuss this.